So here we're talking about PEEK. PEEK is colorless, organic, thermoplastic polymer. The features that make it a very sort of appropriate material for interbody cages is it's biocompatible. Importantly, the Young modulus is comparable to bone. So if you go to the right side here on this graph, you see PEEK at 3.8. You see cancellous bone at 3.8 exactly. Cortical bone a little bit more. So PEEK is right in there. And the importance of having an appropriate Young modulus with grafting cannot be overestimated. A lot of the stuff that we do in our laboratory, we see tremendous impact on ingrowth of different grafts depending on their Young modulus. So again, the importance of that is really almost impossible to overestimate. Another very nice factor of PEEK is the imaging that allows for good postoperative imaging, both with CT scans and MRIs with very little artifacts. It's easy to manufacture, which is important for the scalability, and again, as Dick pointed out, to have the cost efficiency, which is becoming more and more important. Limitations of normal PEEK, however, that the surface is hydrophobic, and that means that there's a lack of a bone bonding ability. It's now about hydroxyapatite. Hydroxyapatite is a naturally occurring mineral, typically seen as calcium apatite. And the hydroxyl group of hydroxyapatite can be replaced by fluoride or bichloride. And importantly, it's the main inorganic component of bone. In bone, we can find approximately 70% hydroxyapatite, and then 25% organic substances and 5% water. So HA PEEK is now comprised of 80% PEEK and 20% of hydroxyapatite. Importantly, the hydroxyapatite is not only coated on the surface, but it's through and through that material, which is really important in order to provide structural integrity of the graft long term, as well as it lets you modify it in the ore, and you can easily drill off some corners if you have to. Structural and mechanical properties of PEEK are combined with the osteoconductive properties of hydroxyapatite. As mentioned, the hydroxyapatite is evenly distributed throughout the PEEK, so it's not a coating kind of system, it's throughout. And again, there have been issues with other grafts where different coatings have been detaching or coming off, and so that's an extremely important part of this type of graft. So let's go back to the origin, so the underlying data. So HA mixed with polyethylene has been created to provide artificial bone void fillers. And again, as you can see here on the right graph here, bar graph, I want to point out that here's the volume fraction of hydroxyapatite. And if you go up to 0.1, 0.2, look at the Young's modulus, we're right at 3 to 4, which I'm sure you remember is roughly the Young modulus that we have of cancellous bone. And so it's almost an ideal graft, mimicking the properties of bone. And importantly, it has the osteoconductive properties to enhance bone apposition. And so here is comparing this graph, this table compares PEEK Optima, so normal PEEK with HA Enhanced. Again, the modulus is very similar. And as you can see here, the properties of PEEK only marginally changed, and it still resembles very much cortical bone in this table here. And this is very important from a practical perspective, the imaging properties. Here's your CT scan of a 6-month, one of my cases, 6-month post-op case, standalone ALIF. And this is a very, very normal sort of like appearance of these grafts. You can see the bone, the bridging bone right next to the graft. And again, there's barely there's absolutely no artifact from the PEEK. Again, there's a small integrated plate here for this ALIF graft. But again, very nice imaging properties. So let's dive in a little bit into the biologics. So in vitro studies have investigated the effect of PEEK supplemented with HA, and have found that it supports the osteoblast differentiation. On the right, there are bar graphs. You can see that when culturing osteoblasts with either PEEK, the black bar graph here, compared to HA PEEK, the gray bar graph, after 14 days, there was a significant increase in osteophosphatase activity, indicating an acceleration of osteoblastic differentiation. And so it promotes an upregulation of protein related to calcium ion processes in cell adhesion in vitro. And again, up here, the phosphatase activity was increased. So clearly, this material supports the activity of phosphatase and the differentiation of osteoblasts. And that is nicely shown here in this figure down here. So we have HA PEEK in a preclinical cervical spine fusion model in sheep at 6 and 12 weeks. And here on the left side in this graph here is normal PEEK. Left side is the PEEK, right side is the bone. And you can see this bluish appearing fibrous tissue that separates the PEEK from the bone. And I'm sure everybody who has ever explanted a PEEK graft has seen this, as the PEEK cages are difficult to move out. However, they're always not fully integrated, and there's a little bit of a wiggle. They're always surrounded by some fibrous tissue. And with the HA PEEK, we see complete approximation of the bone onto and on growth onto the material with HA PEEK. And this was also confirmed with a micro CT of these grafts in sheep, where this study showed that there was a higher quality of new bone bridging found with HA supplemented PEEK compared to natural PEEK. Another very exciting sort of possibility is that the potential future applications of this material, again, as you will see with the cases in the database, we are both extremely excited about the clinical results and the radiographic results of the material, but I think there's quite a lot of prospective opportunities for this. For example, there is the possibility to generate porous HA PEEK, which appears to enhance the osseointegration, and also to promote bioactive PEEK implants by coating those with charged particles and allowing to further enhance their properties. So there's a nice pathway for future innovation with this type of material. And so I want to give it here back just a couple of cages of it currently available from Innovace's T-lift cages, cervical cages, standalone A-lift cages, and PLIF cages, and you'll see those implants later in our case series. And again, I just wanted to quickly sort of go back to this burden of proof sort of slide. So we have to show that using these new materials improve fusion rates, reduce the cage subsidence, cage migration, reduce the rate of reoperations, and improve the clinical outcomes. And we hope that we can show you some new data that really seems to support these kind of things. So looking at the preclinical studies, HA PEEK facilitates bone on growth. It images well across modalities and has a module similar to bone and is cost effective.